Welcome everyone, this is Dr. Jaitly, your cardiologist on your favorite website, MuniMeterHealth.com, which is dedicated to educating you about the human heart and its illnesses across the globe. And I personally want to acknowledge my thanks to everyone who has given this enthusiastic support to further this knowledge and my cause of spreading this knowledge freely to medical fraternity as well as to the general masses. So without any further ado, I like to delve into the subject matter. And before I do that, I just want to warn you that, again, if you're having an emergency, please consult your doctor, go to the nearest hospital, or call for an ambulance wherever you are. Okay, so because this is primarily only an educational video, and the reason I do this is primarily, again, to education, for educational purposes, mainly for clinical education for the medical fraternity, and then patient education for the general masses, because both of them will really determine the clinical outcomes, as I always say. So it's very important that the clinical education and patient education are enhanced, and that's my one initiative which I have continued over the past almost 4 decades in my careership. So having said that, now let's understand what the subject matter today will be. The subject matter here is, how does aspirin work? Now, aspirin, we know it's a wonder drug, and it's been around for over 50 to 60 years almost now. We know pretty much not enough about other drugs as much as we know about aspirin. So just so that you know, it's a very, very important drug in the cardiovascular system. All cardiologists, a lot of internists will use it, and primarily mainly for circulatory anti-thrombotic purpose. So we know that it has an anti-thrombotic action, if you will. So in other words, wherever there is a thrombus or a clot that's forming, it will prevent it from happening. So say if you have an artery here, if I wanted to show you an artery like that, or a vessel, and it has numerous red cells, if you will, we can draw some red cells here around, and then we can draw some, if you will, some platelets, and then of course there are some white cells also present. So having defined that, now we know that the platelets, they normally are responsible for clotting mechanisms. So then normally they are about 1.5 million to about 4.0 million per cubic millimeter of the blood. So that's your normal count. So anywhere between 1.5 to 4 million platelets are circulating in your body, and their half-life, just so that you know, is about 7 to 10 days. So these are the facts already, which are already known. Now, aspirin has its effects. Aspirin has a half-life of only 20 minutes. Remember that. So if you take an aspirin, it's going to last only about 20 minutes on the platelets, but the platelets will be blocked for 7 to 10 days because that's where the half-life is. Now let's understand how does aspirin work. So aspirin, what it does is, now you have, say, we'll draw the heart, for instance, here. Now that's my favorite schematic. Okay, you have the coronaries here, another coronary, right coronary coming out and again extending here, and then you have the left circumflex here. So these are your various arteries here. We've just drawn. Now the coronaries, they can block, and that's called coronary thrombosis. So remember the thrombosis, like the anti-thrombotic action we just talked about. So these thrombi can occur everywhere, and that's where we put these stents, or ultimately give you bypasses. And I'm sure we have discussed all of that in other videos. The whole idea is wanting to see if we can actually prevent any further clots forming in these arteries, especially the coronaries. Why? Because obviously, if you have coronary thrombosis, that leads to angina, and unstable angina, and therefore later on into an MI, which is myocardial infarction or heart attack. So likewise, you may have thrombosis in the cerebrovascular arteries, and that leads to, again, a stroke. And so therefore, stroke or TIA, for instance, all those things can occur. And so these are very various territories where again, aspirin will work, because aspirin, wherever the bloodstream goes, automatically in all coronaries or in all cerebrovascular system, or in peripheral vascular system, for instance. Now you have the peripheral arterial disease, which is tending to have increased thrombosis, specifically so in smokers and diabetics, and severely severely arteriosclerotic or atherosclerotic vessels where patients have increased risk factors, including high cholesterol, obesity, hypertension, genetics, and family history, etc., etc. So again, you can develop a peripheral vascular disease, and this could be prevented as well in these individuals. So the whole idea is wanting to see where thrombosis can be prevented by aspirin. Now, aspirin, the mechanism of action of aspirin is the following. Remember, on the platelets, we have various receptors, and we're going to just only talk about one receptor right now per video here because it's very, very, complex. So I'm just trying to make it very simple and quick so that this way we understand how the aspirin works. Now, aspirin has its own, platelets have their own receptors, and they are called COX. These are cyclooxygenase enzymes which are responsible. Now, the COX is, if you say COX-1 and COX-2. Now, later ones are COX-2, but and they're also called COX-CYBs. But aspirin really works on COX-1 and COX-2, both types of receptors. So basically what it does is aspirin will inhibit the COX-1 and COX-2, and as a result, now what will happen is arachidonic acid, which is normally present, I'll write it down, arachidonic acid, which is normally present in platelets, is converted into prostaglandin G2. Okay, and prostaglandin G2 later on becomes thromboxane, thromboxane, and A2, and this is responsible for platelet aggregation. Remember, a platelet aggregation is the action that the platelets have. Now remember the platelets we just talked about, the platelets here. So these platelets, they are responsible for this platelet aggregation. So normally we need a thrombus to form whenever we have a little bleeding, right? There's a purpose for everything. So platelets have a purpose in our body, and basically wherever there is say while shaving somebody takes a little nick, or while you're working in the kitchen you cut yourself somewhere, or wherever you hurt, say you're working in the yard and you get a little pinprick or a thorn prick. So the whole idea is wanting to see immediately in the body, the platelets will rush to that site in the vascular system and try to plug that little bleed, and immediately a thrombus will form. So the platelets are very, very important, remember. But what happens is, in a setting where somebody's prone for somebody who has increased tendency for coronary thrombosis because of atherosclerotic plaques, high cholesterol, smoking, etc. So those coronaries can actually thrombose, or cerebrovascular arteries can thrombose and make somebody go for a stroke. And same thing happens with the peripheral vascular disease. So these are abnormal entities where the thrombi are forming, and that's why we need an anti-platelet agent or an anti-thrombotic agent, which will work on cyclooxygenase as a result, and therefore prevent the conversion of arachidonic acid to prostaglandin G2. Now, prostaglandin G2 is responsible for forming thromboxane A2, so that is inhibited. So what is happening is, now you give platelets here. So this is where the platelets are. Now we'll just use another color here. Say the platelets are right here. Okay, so if you give the platelets arachidonic acid, to PGG2 is inhibited, so that is inhibited. As a result, PGG2 to thromboxane A2 is inhibited, so that's not forming. And if that's not forming, the platelet aggregation is inhibited, so that's not forming. So as a result, what happens is you have an anti-thrombotic action. In other words, no thrombus in that region. So very, very important, and that is your desirable effect by giving the platelets. The only caveat to that is, remember, the aspirin, even though it's working only for 20 minutes, once you give it an aspirin, you've blocked the entire cyclooxygenase system in all platelets of 1.5 to 4 million platelets per cubic milliliter of your bloodstream. All the platelets have no aggregation happening. So as a result, for 7 to 10 days, because that's the turnover of the half-life of the platelets, and it'll take about 7 to 10 days for the entire system to turn over the entire platelets. So till the new platelets come back into the arterial system, that anti-thrombotic effect will last. So it's a wonder drug, but at the same time you have to also use the caveat in your head and say, look, by the way, I cannot clear this patient. Somebody's going for, say, dental operation or dental surgery, a procedure, or somebody's going for abdominal surgery, elective surgery, or a hip surgery. You have to stop the aspirin for about 7 to 10 days prior. The reason is because platelets take about 10 days to turn over within the body. Until the new platelets come back, then you'll have the normal thrombotic action. Otherwise, these patients can bleed a lot during the procedures, and sometimes even it could be a fatal or require tremendous amount of transfusions, because you end up giving a lot of platelets to these patients to really continue the procedure. Of course, in an emergency surgery, if somebody has to go for surgery, that's a different story altogether, because then you have to have the platelets ready and give the platelet transfusion available to these patients. Okay, so within the scope of this quick short video, I wanted to discuss how the aspirin works. And as I said, it's a wonder drug. It has basically an anti-thrombotic action, and that could be blocked primarily by giving a small aspirin, 81 milligrams to 325 milligrams, depending upon the entity. And we'll talk about the dosages and differences between these various events at a later time. Okay. And I thank you for your interest for watching MuniMeterHealth.com, and hope you learned something on this little small video about aspirin, how it works. This was based on a suggestion. Somebody asked me and said, look, wrote to me and said, look, maybe perhaps this is a very, very commonly used drug, and could you please elaborate on that? So I thank you again, and mainly, and please send me your suggestions and press that like button, because that's very important for us that you're watching, and this way we can communicate with each other and we know exactly who is watching, and how people are reacting to it. And it's a great feedback for a teacher like me, and I'm committed to only educate and spread the education, both for clinical education as well as for patient education. Even the patients now, the general masses, they fully understand why platelets are to be inhibited in a setting where you have, say, a heart attack, or you have a stroke tendency, or you've had a stroke, etc. And therefore, and then of course the caveats are very important, that there are bleeding tendencies that can occur, so you have to be very, very cautious. Tell the person that, hey, look, don't be too scrupulous about brushing, etc. You might bleed from the gums, and these are some of the things that we always tell. And monitor the platelets periodically, just to make sure that the platelets are not going down in their numbers. So normally once or twice a year, if you can monitor the platelets, that will be also very helpful. Okay, thank you again for watching MuniMeterHealth.com, your favorite website, which is dedicated to teaching you about the clinical education and the patient education on our two social media channels. So long until then, this is Dr. Jaitly.